let's just specifically talk about the air quality. I think it's, especially in Delhi, in several parts of North India, the air quality has deteriorated. How does this specifically impact COVID-19? I know you just talked about respiratory diseases largely, but specifically COVID-19. Are we likely to see cases spike just because of air pollution?
Yes, we are likely to see that to happen, and there is evidence to support that. There are a number of studies. One study was done during the SARS outbreak in China, and that looked at the correlation between levels of air pollution and the COVID-19 patients,
Right.
and found a direct relationship, with SARS patients, and found a direct relationship that those areas where pollution levels were high had higher number of sick patients with SARS infection. More recently, there's a study from Italy, northern part of Italy, which has also looked at districts where pollution levels are high and shown that there was an increasing number of cases there with a higher mortality.
Yes.
So there is definitely data which suggests that because of air pollution, the virus actually causes more severe infection, because air pollution itself affects the lungs. It causes inflammation of the lungs. It decreases the immunity. All of this is what the virus needs to have to propagate itself. And that's why the combination can be very deadly.
Well, that's not good news at all, Dr. Guleria. Do you then reckon that the third wave that Delhi is seeing right now will perhaps be more dangerous than the first two?
We're already seeing that there are more number of cases now than ever before. And unless we are very aggressive, both in terms of our individual responsibility and taking action in terms of containment, in terms of tracking, testing, and in terms of making sure that we are able to prevent crowds which can become super spreading events, we will have a huge number of cases, and this is going to cause a strain on the hospital services itself. Therefore, we need to really upfront start very aggressive actions at multiple areas, so that we contain the number of cases.
A new study has also linked COVID deaths to air quality. Can long-term exposure to air pollution that many of us actually have had increase the risk of COVID deaths?
Yes, so if you look at data which has emerged, it suggests that if you're having a long-term exposure to air pollution, and we've been talking about this for the last many years, it really leads to weakening of your immune system and causing inflammation in the lung. It's like people who are living in areas of high level of air pollution becoming regular smokers or smoking cigarettes regularly.
Yes.
And indirectly, we know that smoking itself can lead to, is a factor where COVID can be more serious.
Yes.
So when we are living in an environment for years where we're breathing in air which is polluted, it's affecting our immune system, it's affecting our lungs, it's causing inflammation in the lungs. We've seen pictures of how the lungs of Delhiites look like, looking more black than pink.
Yes.
And when we have such lungs and then there is a secondary infection with the virus, it causes much more severe disease, leading to more damage, and this can actually have long-term implications.
What can one do for people who continue to live in several parts of northern India that are adversely affected by air pollution? It's a recurrent phenomena at this time of the year. And for people who are stepping out and going back to work, not everyone has the luxury to stay at home. What are some of the precautions that one can take at this time to perhaps prevent your condition from worsening?
So first is that if you are a high-risk group, be careful when you go out. Use your app or look at the air quality and then take a call on whether it's you should go out or not. Go out when the sun is out, so that because hot air will lead to pollutants rising from ground level, and the ground level pollution will come down to some extent. Also, wear a mask properly, because mask may give you some protection both from COVID and from inhaling pollution. And at the same time, be careful about going to places where the air quality is really bad. That could be traffic intersections or could be areas where pollution levels are very high.